Sure, Philip. Thanks for having me back. It's been a while. As you know, I have a doctoral degree in microbiology and molecular cell sciences with subject matter expertise in virology, specifically with respiratory viruses. So I spent a majority of my career working with influenza. I've worked with mumps, RSV. I've managed government contracts for vaccine development and testing of candidate vaccines for hemorrhagic fever viruses. More recently, I worked as an epidemiologist at the Hawaii Department of Health, where I was on the front lines of the pandemic response in Hawaii. And I was subsequently discharged from my position there for blowing the whistle on the corruption in Hawaii. And it's all outlined in my book entitled Pandemic in Paradise.
Both of you are scientists who are willing to speak out and risk the wrath of censorship. Starting with you, Jennifer, what is it that made you take that position that most people would not do?
That's a good question. I guess as a scientist, I'm trained to be skeptical. I'm trained to question things. And early on in 2020, when the PCR test was first rolled out, red flags went off. And, PCR, I've done thousands and thousands of times. I've designed, developed, performed PCR. I could probably do it with my eyes closed. So when I first heard about the PCR test and how it was being done, that really started me, something went off and it was like something just doesn't seem right here. And as time progressed and the pandemic progressed, there were a lot of alarm bells going off because the response did not seem proportionate to the threat. As somebody who's worked with these viruses, who's done vaccine development and testing, there were a lot of things that were being done that just were not making sense to me. And as a scientist, as I said, we're trained to question. We're trained to critically think about these things and ask questions and discuss. And being in Hawaii was very difficult because I was in kind of a scientific vacuum. There really weren't virologists or other infectious disease researchers there who I could talk to and ask these questions to. So I turned to social media, obviously LinkedIn, where the professionals are. And I tried to start to discuss with my colleagues, like, hey, am I seeing this right? Is this correct? Like, what's going on here? And started asking questions and try to get this discussion going, because that's what we do as scientists.
Why did everyone else sit quietly? That's something the public is trying to understand.
Well, as I told people, you have to consider the source. The first thing I always do whenever, somebody presents me with something is I ask, who is this person? What is their background? What is their expertise? Who is paying them? You have to follow the money. And in this case, that is the key. Follow the money, because that's what it's all about. And that's why a lot of these people, and I kept telling them, who's telling you this? Is a politician, a journalist? What do they know about viruses? What do they know about vaccines? Who's paying them? We know now, here in the US, we're one of two countries where pharmaceutical companies are allowed to advertise all over the radio, all over the TV. Every other ad you hear on the radio and you see on TV is sponsored by Pfizer, sponsored by Pfizer. Everything is now sponsored by Pfizer. Follow the money. It's very simple.
Didn't work the way we should. This is what I mean, is I just don't understand how people don't ask those questions. What's going on?
It is very troubling. I'm not a psychologist, so I don't understand. I have this conversation with my friend who's an infectious disease behaviorist all the time. And even he's confused. Like, how did these experts fall for this? How did these clinicians and scientists just go along and continue to go along and swear up and down that everything was great and everything we did was just right? And, they're patting themselves on their back. And look, they just gave Dr. Fauci an award and a big monetary money, for, his role, and he's a hero. And, all of these people have now, again, follow the money. All these people have now cashed out. Look at where they've all landed. Dr. Birx and Dr. Fauci and even former CDC Director Robert Redfield. Look at where they've all landed. They all have great consulting gigs with pharma companies. I mean, there's
Right.
some great studies that have come out that basically have proven and vindicated what a lot of us have been saying, immunologists, vaccinologists, and Garrett. You've had Garrett Vandenbosch on your podcast several times, and he's now, I think all this evidence is coming out to prove what he was saying all along. And the one study came out that showed that, we've talked about this before, after the second, but most likely after the third injection, what we're seeing is a skewing of the immune response towards IgG4, which is tolerance. So what we're doing is programming immune tolerance. What does that mean? That means that when your body sees the offending protein, it will no longer react. So what that's called is pathogenic priming. So we're allowing the body to ignore now the spike protein because they've been given so many injections. So pre-pandemic, there really was no data. There was no data on multiple sequential doses of mRNA injections. There just wasn't. Now we know from mRNA therapeutics, where that was used for cancer, we know what happens there, and it's immune tolerance. The other paper that just recently came back out was a Japanese study where they showed what happens after the fifth dose. I don't understand why we're up to 5. I've heard there are places where they're up to 7 now, doses of these things. And who would think that it was even appropriate to give 7 doses of a so-called vaccine over 2 years? That seems unconscionable to me. But after the 5th dose, what they're showing is not only do individuals not develop a cellular immune response, which is the memory immune response, but after the 5th injection, their percentage of people who actually acquire a cellular immune response decreases. So what you're doing is eliminating the cellular immune response, which is the memory response, which is what responds when you do see the offending pathogen again. And this has to do with T cell exhaustion. So immune tolerance and exhaustion go hand in hand. So we're skewing their immune response, and then we're just obliterating it. So people cannot no longer respond. And I think this is why we're seeing an increase in infections with other, Garrett talked about this. He talked about this many times. This is why we're seeing now an increase in infections with other viral pathogens like RSV, and possibly flu. Yeah. So, I mean, the studies are coming out now to prove what we knew all along. I mean, it's very troubling, Philip, because, as a scientist who was vocal from the beginning, sometimes I get so upset because I thought, if people had listened, just imagine the damage that I could have prevented if I could have had more of a voice in the beginning. If Garrett had been listened to by the world leaders and by the WHO leadership, just imagine what we could have prevented, the pain and suffering we could have prevented. Now, I sent this graphic before about the phases of the pandemic. And in that, I put that out there in 2020, early 2020. And the 4th phase was the damage to the response to the pandemic. So, and I know we've talked about this before. I've said it, a couple years ago now. I can't believe it's already been a few years, but I said this on your podcast before, is that we need to pivot to start looking at ways to treat those people who were damaged by the injections. And here we are. And I believe this is now the new pandemic, is all the damage and all the damage. Yep, there's the 4th wave, all the trauma, all the illness, all the mental, spiritual,
So
financial
just break
stuff.
that down for us a minute. So what is the first wave you're saying here in purple is the immediate mortality and morbidity with COVID-19.
Right. So that would have
Goes
been
up and it comes
2020.
down. That's 2020, 21, and so on. The
Right.
second wave you have is the impact of resource restrictions on non-urgent COVID. Okay. And that goes up and down. The third wave is this one here, which is the impact on interrupted chronic conditions. That goes on over time. And this 4th wave, what is this here? This is mental illness, economic burn,
This is the
economic
effects on all
influence.
the other health,
Mhm.
all the other aspects of health. We've talked about mental, emotional, spiritual, financial. Those are all very important aspects of health. And we're still seeing that. And we're seeing it more so now than we were in the first year or two of the pandemic. So, as I've said before, all the human intervention did was make things worse and prolong it. And here we are. And instead of taking a step back and saying, oh, wait a minute, maybe we need to reconsider what we're doing, they just keep doubling down and tripling down. And we're at what, 5, 6, 7?
8.
So instead of stopping and taking a pause, we're now just keep doing the same thing we're doing. Is that's the definition of insanity. Just keep doing what you're doing and expect a different result. So like you, Philip, early on, I said, okay, targeted protection was really the way to go. So what we want to do is we want to protect the vulnerable people. And, I had kind of mixed feelings about vaccinating them because I knew that giving the elderly these injections, they were already at more risk for severe disease. Injecting them, they would be more at risk for adverse events as well. So, do you risk? It's about risk versus benefit. How many times I have to say that? Risk versus benefit. What is the benefit you're going to get if somebody is older and they get the vaccine and they're not going to live long enough to develop myocarditis or cancer anyway? Then maybe it gives them a few extra months. Okay, great. But as Jancy said, early treatment was always the key. Whenever you're dealing with an infection of this type, what you want to do in order to lower the burden, not only in the population, you have to lower the burden of virus in the individual. So if you decrease the amount of virus in the individual person, there's less chance they can spread the virus to other people. So early effective treatment, decrease viral load in the people. Individuals will decrease viral load in the population. You limit spread. It's really a no-brainer. And we've talked about this before. Being on the front lines, I interviewed people. I talked to those people, the people who were sick, the people who were quarantined. I talked to their coworkers. I talked to their family members. I talked to all of their contacts. And the thing that always struck me was in the beginning, we were like all very concerned about getting them to doctors and getting them. People who got azithromycin and budesonide and inhalers were doing great. They were just recovering, doing just fine. And at a certain point, it was like doctors broke. They couldn't figure out how to treat people anymore. And they were calling me, asking me what to do. I'm a person here with a fever and a cough. What do you normally do? Treat the symptoms. Treat the symptoms. And it got a few months in, when things started getting really scary, it was like, just stay home until you turn blue and can't breathe and call 911. When do we ever do that? Philip, pneumonia is very, very serious. You don't just ignore it. If somebody has any lung involvement, it's immediate. You throw anything and everything at them. I've said this before. Why were we not throwing the kitchen sink at it? Why? People need to ask themselves that. And it's very clear. It's very clear.
It is primarily going to be affecting the vaccinated cohort, but it is potentially still a risk to your whole population. That's the unvaccinated cohort as well. What do you do?
Well, unfortunately, Philip, at this point, it's at the individual to help to ameliorate that for themselves. And we can make recommendations, supplements, exercise, things they can do to boost their immune systems. But, again, I can't force anyone. I had a coworker. This is kind of a funny story, but not so funny. I had a coworker at the Department of Health who was diabetic, and he used to drink cans of soda, just cans of soda throughout the day. And we would like, why are you doing that? Like, you're diabetic. And he would say, well, needles and insulin are free. So there was no need for him to change his behavior. So unless there's some impetus for someone to change their behavior, it's unfortunate. But, getting people to do what they need to do to help support their immune system and boost their immune systems is going to be on the individual to do that.
So, Jennifer, and assuming that what I think is going to happen happens, which is that we start to see a surge in very severe pneumonias, especially in children, as we're seeing. So, the stronger the immune system, actually, if this is a hypersensitivity response, the greater the damage that we're going to see. How are you going to reassure the public?
I mean, that's the question we've been asking now, is how does public health regain the public trust, right? And I think what Jancy said is 100% is you have to be honest. You have to be honest. And I said this in 2020 when I spoke out against the state epidemiologist in Hawaii. I said all they had to do was say, we were wrong, we made a mistake, and we are going to do better. You have to start there. You have to start there, because you have to just say, look, admit your mistake, admit it. That's the only way you're going to get people to start listening to you again.
But it comes at a personal cost. And I'm saying that the people are not going to do that.
What's more important? What's more important? That proves right there. That proves right there, Philip, to me. It proves right there. And that was the whole problem in Hawaii. Personal perception was way more important than public health. And that's why I burned it down. Because what was more important should have been the public health and the people and reassuring the community, not how I look in front of a camera.
What do we do now? That's why I said, Jennifer, public health, people are going to quite likely be very afraid. How do you reassure them? How do you bring a plan? This is going to be scary times, especially it's affecting people's children.
I mean, there's a lot of people in public health who are still deluded, thinking that they did the right thing the first time. So there's still a lot of people out there who are in charge who think that they did nothing wrong. And so they're going to continue down that path, unfortunately, for the public. And so you have to get people in those positions who are willing to say the truth. It's, again, be honest, be open, honest, transparent, communicate to people. You know, when I was talking to people in 2020, when people are afraid, you know, you have to listen. First is listen. Listen to what they're saying. Listen to what their fears are. And then, you know, they're very real. The fears that they have are very real. And, you know, partner with them. How can we work through this? What can I do? There were many times where there are people I said, okay, I'm going to walk through this with you. You know, I will be here with you. I will walk through it with you. We will get through this together. You know, people need to know that they have a partner, somebody they can trust, that they can turn to, that they can get that assistance from. And there, unfortunately, public health is just as broken as our healthcare system. It's just as broken as corrupt. And that's what I learned throughout the pandemic, which is very disheartening. It's very disheartening.
It is.
Well, the thing is, you know, when I was a kid, Phil, what we talked about, sunshine, vitamins, get your sleep. I had to drink milk at dinner time. I could play outside till the streetlights came on. You know, we got our multivitamins, our little Flintstone vitamins. You know, we were in bed by 8 o'clock. You know, there are a lot of things we're still not talking about. Basic health measures that you can take to, you know, I mean, it seems so simple, but why are we not talking about any of those things? Because they don't make anybody any money. I mean, parents really need to step up and start taking charge. Take the screens away from their kids, number one. That is doing so much damage to their mental health. Get the screens away from them. Get them outside. Get them in the sunshine. Get them active. This is so vital and so important for children. I think what it all comes down to, again, is risk versus benefit. Look.
Absolutely.
I mean, there's some great studies out there. I wrote a Substack about this, which I think is just fabulous, is what are the off-target effects of vaccines? And this is an area of study that's just really underfunded. We know when we develop a vaccine what the effects are on the disease for which we develop it for. But what are the other health effects of these injections? We need to start asking these questions. And there is some great work and publications out there that show there can be positive health effects, positive other target health effects from vaccines. And it was shown that live attenuated vaccines have the most benefit in terms of decreasing excess mortality. However, the inactivated vaccines have the opposite effect. So we need to start looking at not just the effect and the benefit of a vaccine on the disease for which it was developed, but also other off-target health effects that we can be seeing, like BCG. They talked about this during the pandemic. People who got BCG in Asia is huge. We don't get that vaccine here in the US, for TB, but it's widespread in Asia. So they give the BCG, and they showed that BCG actually could have had a protective effect. Again, what is the other health effect or other health benefit of giving this injection on other diseases, on other disease processes? So I think this is something that we really need to fund and start looking into more.
And Jennifer, your thoughts?
Oh, I think the biggest message I can say is you have to be a consumer of your own healthcare. You have to be your own advocate. We know that the healthcare system, at least here in the US, has been largely corrupt for a very, very long time. We now know that the public health system is corrupt as well. So be a consumer of your own healthcare. Do your own research. Those are the scariest words for these people now, is they did their own research. Do your own research. Talk to people. Get a second opinion. Get a third opinion. Also, do what you can to boost your own health. Do what you can. It sounds funny, but they are starting to take nutritional supplements off the shelves. They've already taken one whole company out because they're selling nutritional supplements. So you need to do what you can. The food you eat, what you put into your body, how you move, what you put into your mind. It's all so very important to build your own health. So build your own health, be your own advocate, be a consumer for your own medical care.
Excellent. Great evening.
All right. Thank you.